I am St. John the Baptist Parish President Natalie Rowbottom, and I will serve as the moderator for this event. Although he's not here right now, he's at Mass, I'd like to thank Father Amati for allowing us use of the gym for this meeting at no charge. I think he's going to try to come back in, Ms. Tammy Houston. Are there any other elected officials here? Well, thank you, and of course, thanks to my staff for facilitating this meeting. The purpose of tonight's meeting, which is scheduled to last about 1 hour, is to inform you, our citizens and community stakeholders, about a new cancer study in this area and to explain how you can get involved. A presentation will be made momentarily, but the main purpose of the study is to address concerns about the Louisiana Tumor Registry not having information about all incidents of cancer in the community. I would like to welcome Nick Alvarez from the Governor's Office, Governor John Bel Edwards, Dr. Rebecca Gee from Louisiana Department of Health, and Dr. Donna Williams and Dr. Ed Trapito from the LSU Health Sciences School of Public Health. Thank you all for coming out this evening to present this very important information, and we're asking that you hold your questions and comments until the end of the presentation. We're also asking that you keep an open mind during the entire process and support the project by participating. You can accomplish this by attending meetings, getting involved, and reviewing the project plans alongside the experts. Our goal tonight, and as always, is to secure a better health culture for our community. This is important to all of us, and we all have a role to play. Again, we're grateful that all of these professionals joined us this evening, and we'll move along with the program. Now, I'd like to call Mr. Alvarez with Governor John Bel Edwards' office to the podium to offer a few words. Mr. Alvarez.
Thank you, President Rowbottom, and thank you all for being here tonight. Again, my name is Nick Alvarez, and I'm the Health Policy Advisor for Governor John Bel Edwards. And on behalf of the Governor, I appreciate all of your engagement in this process. And I just want to express that this study that we're going to talk about tonight is and has been a priority of the Governor. The Governor personally asked for this study to take place so that we can confirm what we see in the Louisiana Tumor Registry, which is an excellent resource, but which we know we can build upon through further analysis, through further data collection. And I really want to reserve the bulk of the time tonight to really get into that with the experts that we have from the LSU Health Sciences School of Public Health. And so that's really what I wanted to express. I encourage you all to take part in this process. The Governor wants this to be an open, transparent process with the community engaged throughout the way. And so we have that built in. And with that, I'm going to turn it over to the Secretary of the Louisiana Department of Health, Dr. Rebecca Gee, and she and her team have been doing an amazing job as well. So without further ado, Dr. Gee.
For 4 years, and I'm most proud of the fact that we've helped to expand healthcare coverage for over 500,000 people during the duration of the 4 years. That has led to lives saved in a variety of areas, but cancer is the most close to my heart. I am the daughter of a woman who had breast cancer and died when she was a year older than I am. She was born in Utah and grew up in a place near where nuclear testing was done, and folks didn't understand the risks at that time, and she died at the age of 46. And so I acutely understand how important cancer risk is to communities, to families, to children, to mothers, to husbands, and so on. I'm also the mother of 5. And if you'll excuse me, it's my twin's birthday tonight, so I'm going to leave right at 7, but I've left my cards on the table, and I will also give you you can Google me, but my email is Rebecca, rebekah.gee@la.gov. So if there's anything unresolved that you would like to ask a question of, or you'd like to participate or be a part of it, please don't hesitate to reach out to me. As State Health Secretary, we are in charge of not only healthcare, but disaster response and preparedness, public health, and I have several members of my team tonight wanted to recognize Region 1 Medical Director Joe Cantor, my Chief of Staff Tanya Joyner, Megan, raise your hand, Megan Muncie. Is there anyone else from my staff here to recognize tonight? And Bob Johannesson with BMAC. Just wanted to also tell you a little bit about my background. I'm a physician, OBGYN. I continue to see patients, including yesterday afternoon, so that I can be close and connected to the issues that my patients face and help understand how those issues impact them, helps me make my decisions. Our department is focused on ensuring that community is connected to our decisions. We've created an Office of Community Partnerships and Equity, and that office is committed to the mantra, nothing about me without me. And that means that everything we do at the health department, we do recognizing and listening to the voices of communities who are impacted by those policies. So whether it's eliminating the wait list for disabilities, which we've done under Governor Edwards' leadership, helping to make sure that people who want to age in their communities can do so, making sure that we address the opioid crisis, which is ravaging our communities. We do those things in partnership with communities. We listen. And so be assured that I have heard your concern, I've heard your voices, and this process is going to be collaborative. What you're going to hear tonight from LSU, and it's not going to be a Department of Health study, it's going to be an LSU study. But we support, and the governor has made very clear to me that this community matters to him, that we are going to address your concerns with you, you are not being ignored, and that we will work this problem together. What I also want to assure you about is that I have confidence in the Tumor Registry, that the data so far have not shown the risk. We have new information, however, from researchers who went door to door and asked you about your experiences, and that information is what we are looking at with the study. You're going to hear more about what the study is aiming to achieve, but what I want to do is help you have more confidence in the Tumor Registry. So the goal of this is for you to be able to, if we're going to use that to say we believe the risk is not elevated, I want you to have confidence that that is a robust registry and that every case that you are aware of is in the registry and that we understand the same problem together. So that's what we're trying to achieve. You will be involved in the study. There is a community advisory group, and nothing that you've seen in the sheets that are before you is permanent. We want your input, and it's important to us. In addition to my background as a physician, I'm also trained as a health services researcher, and my background is in what's called community-based participatory research. And that means when we do research, and I'm not doing the study, but that being said, my background is and training is in that when we do a study, we involve the community in the design of the study, involve you in looking at the analysis of the study, and make sure that you're comfortable with the results of the study. And so that's going to be part, of course, understanding that we're going to use scientific methods. So that's my background, and that's what I will assure you of that I am committed to doing. I'm grateful that you're here. There are many advocates here. There are many members of the legal profession here. I'm married to one, so I appreciate what lawyers do, and lawyers advocate for communities in ways that sometimes they can't for themselves in powerful ways. And I appreciate the advocacy that this community has, the efforts that you've made, and that they've resulted in action. So I'm going to turn it over to the LSU team to talk about what we aim to achieve. And I'm looking forward to ongoing conversations with you. And again, don't hesitate to reach out to me if something, I had a conversation about vital records. If you have a question about that or anything about Medicaid, please, you're welcome to reach out to me. And it's wonderful to be here. Thank you so much for coming. And thank you, Parish President Robotham, as well for hosting us. Thanks. And Donna Williams.
Can y'all hear me? Do I need to use the microphone? I will if I need to, but I'm a little deaf, so I tend to be pretty loud. Use the microphone. Use it? Okay, I'll use it. That's fine. I'm really excited to be here tonight. I want to start by giving you a little background on how we got here, just in the past few months. You know, we have a lot of great minds in this state, you know, that should be able to put their heads together on issues like your community is facing. And a few months ago, some of those great minds did get together and were talking about, what can we do to answer questions for that community? And then they said, well, Donna makes pretty flyers, so we'll invite her too. So that's how I got involved in. And so what we came up with is what we hope is a starting place. This is not meant to be the end. We're hoping this is a beginning of answering questions for you guys, questions that are long overdue in terms of answers. So one thing that we can do, and what we came up with, and again, all these documents that we gave you are totally draft. Nothing is written in stone because we need the community to be a part of this with us. These are just our ideas. And that is that there is, this study was done that came up with a lot of cancer here that maybe isn't reflected in the tumor registry. So what we can do is we can confirm that every case of cancer that is reported here in St. John is in the tumor registry. So what we propose to do, we talked to the folks who did your previous study. They aren't allowed to release your information to us, and you wouldn't want them to. When they did the study, they promised you that your information would be confidential, and they are sticking true to that, and that is what you would want. So, in an ideal world, they would turn over all your information and we would just go to the tumor registry and see if we can match it, but we can't do that, and you wouldn't want them to do that. You would lose your trust in them if they just gave anybody your information that you trusted them with. So what we're going to do is we're going to come back and we're going to ask you some of the same questions because we don't have access to those information. Then we're going to take the information and the cancers that you report, and we're going to go back and see, is it in the tumor registry? If it isn't in the tumor registry, we can go to the medical records and confirm that and get it entered into the tumor registry. If we can't confirm it in a medical record, we may come back to you and ask you some more questions. But we want to make sure that every reportable cancer in your community is in that registry. We will promise you that if you participate, we'll give you a specific report back to your household on what you reported and what we found, so that you know what's going on with that. So I'm, sort of the community liaison for what we're proposing. I talked to Wilma before we got started, and she volunteered to help coordinate putting together a group from the community to work with this on finalizing the study and getting out and hopefully beginning to get you some answers, and this being, again, a starting place to inform more studies for you guys that answer the questions that you don't answer. Dr. Tapito is an epidemiologist. He's going to be working with us on that end, also from LSU, in terms of the field work and getting out and meeting you guys, talking to you guys, and those sorts of things. So that's sort of a general summary. You'll find the same information here on this purple and yellow page. Down at the bottom is our contact information. We have a website that, if it's not live now, it'll be live by the end of the week. We're going to be as transparent as we can possibly be. We're going to give you all the updates on the website. We're going to come back and talk to you and update and have conversations like this frequently. And you guys need to make sure we're doing right by you and we're doing what you need us to do. There's another document that basically helps explain why we can't, some of the reasons we can't use the previous data, and that's just for your information. And then, we want to make sure people are coming to your house. They're people with us, and it's okay. They're sanctioned by us to come knock on your door, and so that you can identify them and who they are. They should have LSU identification and should be clear who they are. And so then, that's it in a nutshell. I'd like to open it up. We'll answer any questions we can, take any comments, suggestions. Okay.
I just have a question, and I understand that this is, my name is Joanne Fleming, by the way. I stay right here on Chesney Baker Street. I understand this is the second study that we're doing. And I just want to know why. This is the second one. doing a study or doing whatever, I understand that, but that's not stopping people from getting sick. That's not stopping people from dying. When are we gonna get answers? How are we gonna get help? When are they gonna do something? When are they gonna follow regulations? You know, they're talking about, they don't know what to do with the kids at the school because they're exposed to, you know, what they're leaking every day.
Absolutely.
We can have meetings, we can talk about studies, all of that, but we don't have any results. We don't feel like we're being helped in this community concerning that because they're still doing what they want to do. They're not going to pick up and leave. They're not going to go anywhere. So when are we actually going to get some help?
Yeah, you know, I hear you, and I'm going to defer over here to the governor's office on that, because what we can do is only a small, like I said, it's the
And
beginning.
the question can be answered by anybody.
And I think tonight what we really want to focus on is this study. And so I hear you, and we can talk some more, and I'll stay here and talk with folks. But I want to reserve the limited time we have during this hour to really focus on this study and to get questions answered about what's going to happen with this LSU study that's forthcoming.
Are you going to be able to identify how they got the cancer from your study?
Not directly, no. Like, again, this would be the beginning. First, we have to have a good data set that says, you know, these are the cancers that we have here, and then other people that specialize in risk and environmental health can take that information to the next step.
Dr. Williams, can you address our question relative to the first study and the concerns that you expressed and why it's necessary to do a second study? I think it's printed in her handout that she passed out, but just briefly address why it is that you're doing a second study.
There we go. So, we got it? Yeah. Okay. So there are a few issues that make us not able to compare the data from the original study to other data. And as President Rowbottom said, we've kind of outlined some of that in the data handout that you have. There are two really big issues with it. One I've already addressed in that, you know, you guys reported it, but we don't have any way to link that to the data that's existing in the Tumor Registry to see that those cases are in the Tumor Registry. So that's, again, one of the reasons that we want to do it. The other big issues, one is the study that was done based on prevalence of cancer. And that's one of those epidemiologic terms. Prevalence is the number of people in a period of time, generally a year, who are living with whatever the disease is, in this case, cancer. Incidence is the number of people in that period of time who are diagnosed. For most cancer data sets, it's reported in incidence, that is the number of people who are diagnosed. There's a big reason it's not reported in prevalence, which is the number living, and that's because we don't know if that's a good thing or a bad thing. If the numbers are high because there's more cancer, that's a bad thing. But if the number of people living with cancer is high because people are being treated and living longer and surviving their cancer, that's actually a good thing. So that's why other data sets don't use prevalence. So in order to compare your information, the information here in this community, to the state information, to national information, we really have to use the incidence rather than the prevalence.
And this is Secretary. I also want to say, I mentioned earlier, I'm a mother, and I understand how concerning it can be to have children and worry about your health, their health. But policymakers use a tumor registry to make decisions. We look at that data. It is one of the best registries of its kind in our country. So we have an asset to look at risk, but that's what we use. So if there is something that we're missing, where there is risk and we're not aware of it, we need to fix it. So that in the future, policymakers who use that are using something that is valid. So that's why we should do a second study. What the study was done, the methods were not, we're not able to do apples to apples comparisons because there is no record. It's not looking at the tumor registry. So again, if we're going to use the tumor registry to look at cancer risk, which is what's happening in the state, we want to make sure that it's accurate and it's valid and it's got all of the cases in it that are happening in the state of Louisiana. So this is not only something that's going to benefit this community, but the whole state. If we do find there are cases missing, that's important information so that we can make sure that when people make decisions based on risk, they're making that based on the most accurate information.
So why did we get the nickname Cancer Alley? Where did that come from?
Well, you know, that nickname's been around. I don't think this one's working, so, yeah, okay. They're really, really close, okay. I think that nickname's been around for a really, really long time, and I think all you have to do is drive up and down to see where, you know, why you've gotten that nickname. You see the stuff spewing into the air, and of course,
Isn't that reported in the tumor industry?
in the tumor registry?
Yeah, the registry.
No, the tumor registry is just cases of cancer. Sure.
What is the timeline for the study and how long will it take before we get the final results?
We want to do this as quickly as possible. We know y'all been waiting a really, really long time, and you don't want to wait longer. We want to get the community group together before the holidays, and we want to get the folks from School of Public Health who are going to be coming out here to do data collecting. We want to get them out here before the holidays. How long it's going to take is going to be dependent on being able to catch you guys at home and get those surveys done and everything. But we would hope we would have that data collected within just a few months. And again, we'll give you updates as we go along. You know, we found this many cases that were not in the registry, or you guys reported this many cases, and they're all there. We're going to give you all that information as we go along.
I'm a bit confused about what motivates action. You just talked about three issues here, prevalence, incidence, and risk. How do they factor in action? If we know that a certain population is at risk, do we need to wait for incidents? We wait till they get sick? Or if we know the risk is high, do we take them out of that danger? Do we risk people's lives and health? Will we just continue to do what we have been doing, obviously, is waiting for people to get cancer to decide whether we're going to take them or help them or not. If the risk is there, then let's take the people out of danger. Sorry.
I'm sorry, could you repeat the question?
Yes, considering the three options you mentioned, incidence, prevalence, and risk. How do we use this? We get the facts, even the test, when the test is done. If the test shows risk as opposed to prevalence or incidence, are we gonna act? Are we gonna protect the people if we know the risk is there? Are we going to continue to risk the people? We have studies from the U.S. government and their agencies that there is very high risk in certain areas. In this area we're sitting in, the risk is highest anywhere in the country. EPA said that our risk is nearly 800 times the national average. If we're talking about risk and we are aware that something is threatening our population, we have facts that the risk exists, are we going to act to protect these people, or are we going to wait for the incidence or the prevalence? Is all I'm asking. How do we deal with that? Doesn't seem to me to make much sense when we know the risk is high and sit around and wait for a couple of hundred people to get sick, to get to incidence or prevalence. If we react to the risk, and the thing about ounce of prevention. If we know that there is risk, are we going to act to protect those people? Are we going to remove those 400 children from Fifth Ward Elementary School when all facts show us that they are at the highest risk in the country? Or are we going to wait till they get sick to die? If the risk is there, why don't we protect the people?
And Donna, if you could maybe talk a little bit about what the Tumor Registry is showing right now, and then kind of how that relates to, you know, what we're looking to discover in this, or what we're hoping to glean from this study as it relates to risk. Could you speak to that?
Well, the reality is, risk is a prediction. And I can answer that question from two different perspectives. I can answer it from my LSU professor perspective, which would be, you know, I would say as a scientist or whatever, that risk doesn't necessarily translate into actual cases. But then I could answer that as you know, a citizen of the state and say, if I were in your shoes and you were telling me my risk was higher, I would absolutely want something to be done.
Thank you.
Oh, I'm sorry. Hi.
I'll stand up so you can see me. As the gentleman was
Pass
just
the
speaking
microphone
about
back.
this, and the children that they fix to take and move out. What about the elders? And that's good about moving the children. But the one that's already being affected by it, some of them that have COPD behind what's going on in DuPont, in the air, and it's for testing. They've been testing all last year. How many tests do they have to take before it be determined about our health, the health conditions, the stuff that is polluted, the stuff that's getting in our system? I'm speaking of the elders, I'm speaking of everyone as a whole. But as far as the children, that's great, they're young, they're just coming up. But what about some of us that are up in age already and some of them are dying? Whether it's cancer or not, something needs to be done, it needs to be done. I mean, I understand it's a procedure, but I also want to ask this. How many tests is it going to take? People going to have to die by numbers before a resolve be done to it? That's my question.
So, I appreciate your question, and I hear you. And again, I want to circle back to a real focus on this study and what questions folks have. I'm happy to sit and stay here, you know, afterwards, talk with folks about other issues, but I really want to reserve our time right now to focus on this study because, as was said at the outset, we want this study to be one that's guided by the community, that's done in partnership with the community, and that's why we have built-in, you know, touch points throughout the way to check in as this work is being done. And I think that process is something that will lead us along the way, but I think that, you know, that's what we really want to reserve our time to dig into how we're going to do this study here in the community over the course of the next few months.
If I can interject one more time, just from, I'm not anyway insinuating that we hinder this. I'm very grateful to the governor and to all of you for coming here to help us. And I want us as a community to support this 100%. But my point is that I need people just to pay attention to some of the stark realities that we face in this community that's been deemed the highest risk community in the country. We certainly need this test, and I'm grateful for it. I want to thank the governor and all of you for this. And I also want to remind y'all about the election. But we welcome you here, and we want this test. We know that the community, as they did when the university came in, the community cooperated with them. And we're going to appeal to the community now to cooperate with you. But we just wondering, can we save the children in the meantime? That's all. No, we don't want to interrupt this. But what we do want to do is take these young children out of risk. And we have to approach this a piece at a time. Sir, I'd like to talk to you. gotta do it in order, in timely fashion. So I'm advocating that we support this test. It's very much needed. It always was. I'm very grateful to the universities when they came in and did their test. We love it, and we support this. But we just wanna not forget that we have all of these young, vulnerable souls at risk. Thank you.
And let's say, something else. And I appreciate y'all too, don't get me wrong, don't misinterpret it, please. Everything that y'all is trying to do for us. I spoke to one of the lawyers on the telephone over in y'all department, and he had informed me to get copies and send it to y'all, so you can see, but I didn't get a chance to. And I understand what that gentleman said, but I want everyone to know, COPD is a disease, there's no cure. And she got that. We live right there on Baker Street, right here in Reserve. She got that disease, it's a special concern. I appreciate what y'all do, but she may not live. There's no cure for it. And something needs to be done, not just for her, but everyone that has, that's falling from the illness.
Never smoke a day in my life.
I got the papers from the doctor, from the hospitals, and everywhere. From Oxford, her diagnosis of COPD. It's no cure. It's a disease that can't be cured, but you can control it, they say. But it can't be cured. And that's my concern. That's my wife.
And you really bring up a really, really excellent point, and actually, Dr. D and I have had some conversations around the hard fact that we don't have a COPD registry in the state. We don't have an asthma registry in the state. We don't have a skin disease registry in the state or a cardiac registry in the state. And so if you're seeing increases in that, we don't have any way to measure that. The one thing we do have is a really good cancer registry. And again, we're hoping this is a starting point for some ways to answer some questions, and I know Dr. Yee has some ideas about using claims data and things like that to get at some of these other issues. So thank you, I appreciate both of you sharing that with us.
I have one additional question.
Okay, can I, you've had your hand up, you've been so patient, I'm gonna, I'm gonna let her cut in line here.
Yes. I've been a teacher in St. John the Baptist Parish.
Can she have the microphone, please?
Or,
You have to put it right up to your mouth.
I was a teacher in St. John the Baptist Parish Schools for a number of years. One thing that I think should be of interest, I don't know if you can even get this information, but I think one thing that should be of interest is the varying diseases that as teachers we have observed in the school system with our students throughout the years. In the latter years, there were more respiratory illnesses with the kids. The nurses, of course, have this information. All of that information is recorded. I have no idea whether you would have access to that or not. But it's important to know that when I first started teaching, we had no way the number of illnesses with our students that we had in the latter years. Now, I'm just wondering if you could shed some light on that. Is that a possible source of information? And is there any way, you said you don't have an asthma or respiratory registry or anything like that. Well, maybe that's one of the things that can come out of this, this study.
So, by the way, I am wearing my voting in today because I did vote, so I hope we can all get out there. It's a really important election. But in answer to the question, this is exactly the kind of feedback we want from the community because we can add those things to our questions as we go around, as the interviewers go around. And not only is there a place to add things that are not currently there, but any ideas that you have about things you want us to find out about, that's what this is about. And so we want that input. And in fact, yes, we are concerned about those as well. Unfortunately, as Dr. Williams pointed out, we don't have a systematic way of getting that from an existing database. But that's why we need your information, because that will lead us to ask the right questions. We know right now we're focused very much on making sure there weren't cases that are missed that you know about. If those are the case, we want to get them in the registry for sure. I want to figure out what happened, what went wrong if we didn't know about it, or that the registry didn't know about it. But we also want to know about these other things, and we're more than happy to get input as to what should be in that data collection, so that in fact we do collect the information and we do get a better sense of what the issues are. So, you know, all of your comments are important because that will help form a better study. And the study has to be something that you're going to find useful. If you don't, and we obviously have a purpose with the registry, but we also want to make sure that it is meaningful to the community. And so if there are things you want to add, let us know. Let us know, and we'll get them in.
Obviously, we're going to continue with the questions. But again, this is a very specific meeting. And all of the items and questions that you're asking are important to this study. But this meeting is about the study. And just briefly to touch on your concern, Ms. Fleming, the reason there's another study is because there's some conflicts in information. The reason some decisions were made was based on the information in the Tumor Registry, but the data that was collected in the second study suggests something different. So they're trying to verify the accuracy of that information, and that will drive the decisions that will be made relative to what takes place at the facility, in the community, and that's why it's important that as quickly as possible you participate in this study, and that's what we're trying to get at today. So if you could focus your questions and input as Ms. Houston just did, if that's something, an additional question you want added to this survey while they're in your homes, or if there are things that you're seeing that may not have been captured, they need to know that, because they will be conducting a scientific study that they can compare with other similar studies to make some decisions or conclusions about the information and what's going on in St. John Parish. So again, there will be Department of Health representatives here to talk to you all about some of the other things that you're bringing up. But this meeting tonight, and we have until 7 o'clock for this facility, is to address the study and how it will be done and what your part will be. And it's important. You will have a part. I think part of what Dr. Williams suggested, and we've only spoken on the phone, is that you know who's coming to your house. That they're identified as being representatives of LSU collecting data for this study, so that you're comfortable about the information that you're providing. The other thing, and I'm sure with their study as well, they're not going to release your information either. So I think we'd like for you to address more of this study. Again, you're starting it as soon as possible. What is their role? And I think you're going to be asking them to help develop or add to the study that they have planned. And clearly some of the questions tonight will drive some changes to what they have planned. And that's the purpose of this meeting. So could you address a little bit more of that with them, please?
Like we got a bunch of hands. We're going to go here, here, and then here.
I'll make it short. Basically, we've had the EPA risk assessment for 3 years. This demonstrates how cancer risk is very high compared to the national average. Will we have to wait for completion of the study before any action is taken to rectify the known needs that we have in the community?
Thank you for that. Again, I'm going to defer over here because that's not, I mean, I would do anything I can do, but that's not our role, so.
Well, let me try to get this, make you understand what I'm talking about. I agree with everyone, Mr. Teal and everybody, that we want to support this study. Okay, and it's important that you get it right. Okay, and the Tumor Registry is right. My only concern is, I was here about 3 years ago when we had the first town hall meeting, when they alerted the community to the possible problem with dengue concerning possible cancer-causing agency. All right? And at that time, at that night, the Tumor Registry was here. It was here. And they spoke to us about the cancer area. My question is, why this study wasn't done then? 3 years ago. And instead of doing the study now, we possibly would have had solutions and results already from 3 years ago. That's my only concern. Because I was here the first night we had that meeting, okay? And it's just as serious now as it was 3 years ago. So my question was, why are we doing this study now and we didn't take it upon, the state didn't take it upon itself to make sure that the tumor register was right in this area when they came and toured this area, that they had something that possibly could cause cancer. So that's my only concern, is that we, like I told someone, 3 years late. Okay?
Okay, we got a volunteer to answer here.
Okay, my name is Wilma Subra, and I provide community workshops every other week since that meeting we had here with Environmental Protection Agency and the Department of Environmental. And just adding one thing, in the 1970s, we had a supposed cancer risk of leukemia in Koto. And talking to the Tumor Registry, they had this many cases. And we had meetings, and people would call me from the area and give me cases. And I would ask them, who diagnosed, what was the diagnosis, da-da-da-da-da. And can I use this information? And they said yes. So I was able at that time to provide to the Cancer Registry the parts they didn't have. And we've come a long way since that. So the answer to his is, I developed a survey instrument very early on in this process, and the community members went out and conducted a survey in the community. And we had a lot more than just chloroquine. Chloroquine was the focus, but based on all the chemicals that were being released by the DuPont/Inco facility, there were a lot of cancer-causing agents, and there were a lot of reported cases of cancer. We have those information surveys. I can call up those people and ask them if they're willing to have somebody from LSU come to their home and do the survey and try and see whether or not they are in the Cancer Registry. But we did that. One of the problems at that time is my survey was single-sided, and then some of the communities would have copies made at different places, and they made it double-sided. And then the next person would come along and make 20 copies, and they make it single-sided, so we lost the back sides. But we actually surveyed 150 individuals in this community that I can get in touch with those individuals and see if they're willing to let that information be divulged and be able to talk to the LSU people and either verify or scratch off the list.
Yeah, I think we would be fine with that. I mean, I don't see any reason why we wouldn't want that information. I would just ask that you get them to sign something that says they consented for you to release it. And then to further
Back to your question, Mr. Amanier, the reason I think they were comfortable, sorry, that's okay.
The reason they're waiting until now, this recent study that Ms. Wilma is talking about provided data that was different from what's in the Tumor Registry. So that's why there's a third study to confirm what's there and what's not. So it's not that they're questioning what was in the original one, but now that something's changed because there's additional data or different data, well, we have to verify. And again, as she's indicating, because of some of the problems with the actual process, she doesn't have all of her data. So this team is going to go in and make sure that we get it all currently to compare to what was existing. And, you know, if there's differences that affect their decisions, well, then the decisions will be made differently. But that's why it wasn't done before now, because there was nothing anywhere to say that what they had was flawed.
And I would take it a little step further to say, I think probably everybody in this room would agree that studies like this should have been done 10 years ago, 20 years ago, maybe even 30 years ago. But unfortunately, we can't go backwards, but we can go forward. And we're here to go forward with you.
I was just wondering if we can have a discussion with the governor's office as to just what he envisions, or what does the administration envision, could possibly happen once this study is done. And is it possible to schedule these discussions before the holidays?
So my understanding, and Dr. Williams, correct me if I'm wrong, but I think that built into the process, we have 3 meetings, this being the first and then a second, kind of as we're moving throughout like midway through the data collection, and then a final meeting at the end when all the data is collected. And my understanding, again, with the timeline, is based upon how long it takes to actually get that data. And what I heard is that the hope is that all of that would take place as much as possible before the holidays. Is that right?
Yeah, and we'll have as many meetings as you guys want, you guys need. We proposed, 4, I think is what we proposed, but if we need to have 6, if we need to have 8, if we need to be here, every 2 weeks we'll be here, however much y'all need us to be here, and help with making sure those discussions happen.
Dr. Williams, can you address, obviously we're encouraging our residents to participate. Are there things that they can be gathering or collecting that would make their responses to you easier? For example, historically,
That's a great suggestion, actually. We're going to come to you and we're going to say, who had cancer in your family? Any information that you can give Dr. Shapiro and his team on that is going to be really, really helpful, because what they're going to be doing is going back and looking at the medical records. So anything you can gather on the doctors they saw, what hospitals they went to, anything like that is going to be really, really helpful going forward. So yeah, thanks for bringing that up.
How far are you going back? Because a lot of hospitals have closed. We have had floods.
So the plan is to go back for 10 years. Yes, we're aware that that there's at least been one hospital in the area that's closed. And the Tumor Registry, and we've got somebody from the Tumor Registry here, is going to try to find labs, try to find records where they exist. In the event, in this situation where the hospital has closed, we're looking into where those records might be, because there were records. But even if the hospital has closed, for example, if you know what kind of cancer it was, and if there was a doctor, any clue you can give that would be helpful for us to for the registry to try to trace it down, that would be helpful. But yes, and there's also the regional coordinator, is that right, who's here? Okay. So, let me, do you want to introduce yourself?
Hi, I'm Lauren Maniscalco with the Louisiana Tumor Registry, and
I'm Angela Crosswell with the Louisiana Tumor Registry. I'm one of the people that goes out to collect the information for the Tumor Registry with the people that has cancer. And what we do is go out and we would screen the lab, because we get all our information from that hospital where that patient was diagnosed. We go out and we screen the lab. We request from the Medical Records Department a disease index report, which has all the cancer codes on it. And we take that information and bring it to our office, and we make a list. We send that list back to the hospital to pull all those medical records for those patients that have the cancer, and then we go back and we abstract it. At the end of the year, what the hospital will send us something that's called a HIDD list, which is a hospital inpatient discharge data list. And what that is the patients that are not diagnosed by pathology reports or tissue or some type of surgery. It's patients that are diagnosed through like X-rays and clinically diagnosed through the X-rays and stuff. And that the CT reports or of the chest, of the abdomen, of any area that has, that we were diagnosed with cancers that are not operative, that are, that cannot be surgically removed. So we'll diagnose those cases that way. And we also have a quality control person that goes back to make sure we capture all these cancers, all these patients that has cancer. We request the disease index to make sure that we did not miss any cases or any patients that had cancer. So we are, that it wouldn't be reported to our registry. River parishes, I think they closed in 2014. And we have all the cases up, from 1973 up to 2014 was the last cases that we received from River Parish. And I know at that time, actually took over and it became an emergency room and outpatient where patients go and get lab and x-rays done. And I think they have some physicians there where patients see the physicians over there. But we have all the cases from 1973 up until 2014 when River Parish is closed.
Thank you.
So my question is, in the studies that have already been conducted, in the study that is about to be conducted, the studies yet to come, are you including folks that are not residents of our area, but they're employees of our area? Are you including their families that they're bringing their clothing and protective clothing home to? And also, are you consulting veterinary offices for cases of cancer in pets and the Louisiana Wildlife and Fisheries Department for cases of cancer in wildlife?
Those are all important things, but answering that question for dogs and cats, and I would be more concerned, I have to say, about my dog's health than I might be about my own. That information isn't going to go into the Tumor Registry. The Tumor Registry does collect data for everybody all over the state, but the rates are calculated on a geographic area per 100,000 people. So if somebody's living in Kenner and working at Dinka, their having cancer isn't going to impact your rates. That's not to say that isn't important, and some of the, I know the Tumor Registry has done some work with, is it Shell? What's the, is it Shell? Yeah, to other, linkage to other plants, and that may be something that's worth considering pretty quickly down the line, something that's actually a possibility. We gotta go 1, 2, 3, okay?
She sort of answered part of my question. You said y'all have the records from the hospital here. You said you went far back as 70s? 73. Okay, because that was one of my questions. I know this study is going to go back 10 years. That'd be 2009, right? Okay, because my father died of cancer back in '86, but he was not treated at this hospital, or he was treated at the VA because he was a veteran. Okay, so my question is, that information that she talked about and what I just said, how are you going to get that information?
Okay, there's 2 answers to that. One is they're going back 10 years so that they can compare you to other places in the state and the country. They're going to use that same 10-year period. So we're not going to be comparing people that got cancer in the 70s here to people who got cancers in the 70s there. We're going to be comparing that 10-year period. And I forgot what the other thing was. But yeah.
Still will accumulate all the individuals.
Yes. If somebody goes to New Orleans and gets treated, but they live here, cancer cases are collected all over the country based on your residence. So that gets reported for this area, regardless of where they got their treatment.
I think you almost have one question to answer.
Okay.
I understand about the 10-year study, how many people you had in the 10-year area. The information that you gather beyond the 10 years, in fact, people who have passed away, will that number be also considered into possible effect from this area?
It can be. Anybody who's using the Tumor Registry data can use those data at any time period. Yeah. Okay.
And Dr. Williams, I think we have time for 2 more questions.
Okay, so I have these 2. Is there
My question is 10 years going back far enough to really find out about the rate of cancer in this area? We only found out about being exposed in 2015, and people have been having cancer way before that. If you have a member in the family that had cancer 11 years, went into remission, and it's over 10 years that this all has happened, and you're not going to get that recorded. You're not going to be taking any
Right,
kind of that person.
and for the sake of this study, we're using a 10-year period. You know, it would take us years and a lot of money to do, 30 years, 40 years, going back that far. But if we can do 10 years and compare it to 10 years everywhere else, so that we're comparing again, by comparing apples to apples. If you have more cancer here in those 10 years, it's going to show up compared to other communities in the same 10 years, if that makes sense. Is that
Not
helpful
really.
at all? Not really? Okay, I have that document that I did on Data 101. I'm going to try to make that make sense for you, and we're going to post all this stuff on the website. So I'm going to get you a better answer to that question.
Because I feel if a person is in remission for more than 10 years, then they won't be counted.
Right.
But it doesn't mean they're not in the registry.
Yeah.
Because our reference date is 1988.
What area are you going to survey?
So we will be surveying a 2.5-kilometer radius around the Denver plant. And in part, that's because that's what the earlier study did. We want to shed light on what's going on there. By the way, in terms of historical cases, we're still interested in getting that information. One of the problems is if it isn't in the cancer registry, 'cause that's easy enough to check, a lot of the hospitals do not have that data in a computerized way. So it would mean having to dig through record rooms that may or may not exist anymore to try to find out information on that. So it becomes much more labor intensive to do that. Still, we'd be happy to add a question about whether you've had other cases in your family that occurred before the last 10 years, and we will check that.
And I think this is our last one here. But
I've been a resident of this area for over 50 years. I've worked in a lot of these plants. And when I learned of this information, I learned about it from CNN and a news study. I think the community, this information, this study, needs to get into the hands of every single resident here. Because we wasted a lot of time, and the children, the question I really want to focus on is, it seems like in that information on CNN that the children were more susceptible to these cancers and the pollutants from these companies. I want to ask the doctor, why is that children are more susceptible in this area? And, I've been here a very long time. I have health issues myself. But once we get this information in this database, what is our officials going to do? What's our government going to do for us? But we have to have the information. I understand it.
That's a great question. I understand why it's important to you, but I am a gynecologist obstetrician. I am not a scientist in this area, so I can't answer that. What I can answer is that Governor Edwards is taking this seriously. I think the study is going to be very important to understanding the risk for people of all ages, and that information will lead to decisions based on what that shows. Again, I think to reinforce that the study that was done by folks several months back showed us new information, so that's what we're focused on, making sure that we're reflecting on.
And maybe this is actually, I'll let y'all comment and have the last word, but this might be a good note to end on, because I think Dr. Williams said it really well in saying that this is a first step. And so again, on behalf of the governor, I want to reiterate that this is a personal priority of his to see this through. And we know that we need to take this step. And once we take this step, we can determine what the next step is. but we need to take this step, and what I'm hearing is a real openness to engage with the community, so thank you all for being here tonight. This is not the end of the engagement, this is really the beginning, and I think we started to get some really, really great questions in terms of the process of this study, as we went along, which again was and so that's where I really wanted to reserve our time. But this isn't going to be the only opportunity where you can give feedback to that. So look forward to taking this step with y'all and continuing along the way. Thank y'all.
Dr. Williams, did everyone get a copy of the document that she's showing? That kind of gives a little information about what's being proposed. And I think what they're saying today is they're open to amending it. It's a draft. Based on some of the questions you had tonight, some of your concerns, they are willing to amend the study plan, but they need your input. So please make sure to get one of those. And the other thing is, did everyone sign in? So if we need to get you information, we can. Now, for many of you, this is not your first meeting. We've had several, but it is an important start. And again, we're going to request your full cooperation. And in preparation for this study, you have valid concerns. You know your family's history, but you may have to get some additional information from other family members. I'd suggest you start getting that and not wait until the questioners come into your home, but be prepared to get them the information. As she said, as quick as they can get it, they want to turn it around. So that's why it's very critical that you all are prepared and ready to respond to their questions.
Yeah, and I just want to finish up by saying on this form at the very bottom are our action items. And what you'll see down there is there's an email address. If anything comes to your mind, please email us. Helen, you want to stand up right here? I want you to see who's on the other end of that email. This is Helen, and she'll be getting those to me and to Dr. Trapito to answer your questions or to make sure we get your ideas or comments down. There's also the website. I don't think it's live yet tonight, but it will be live by Friday, I would hope. Our communications people are working on that. And then finally, Wilma has volunteered to help coordinate. We want 5 or 6 of you from the community to work hand in hand with us on getting this right. So she's going to be getting with you guys, making sure y'all are in agreement that these are the people that are going to represent you, and she's going to get me that contact information, right? Put you on the spot there. And thank you so much.
And again, I think we have a few other people that stepped in. We do have Councilmember Larry Saraparu, who's been involved from the very beginning. Thank you for coming. And Councilmember-elect Mr. Warren Torres, who stepped in. Did anybody else come in? No? Okay. That's it. Again, this is an important meeting, and your information is important and valid. Again, decisions are going to be made based on the validity or the valid information that's provided that drives the decisions that are made through the Governor's Office and the Department of Health. It's been going on for a while, and we're supporting a resolution to this, but there's nothing more important than you providing accurate information that they can use to make decisions about our community. So I want to thank all of you for coming. I want to thank my staff. If all of you could stand up. A lot of people have been working on this for a long time. And we, again, want to thank Father Amati and Our Lady of Grace for allowing us to use this facility today. And he's open to allowing us to use it in the future. I think having a meeting in the community that's affected is more purposeful and more effective, which is why we're going to continue to try and provide this opportunity. Thank you to the Governor's Office, Department of Health, and of course LSU. And again, some of these people will hang around, but we do have staff here who's going to close up the building. Use the emails. Put the information to us. We'll have a link to their site on our website if you need additional information or if you need to contact them. But as always, feel free to call Bailey's office. She's our contact between all 3 departments to make sure that your questions get to them or that they can provide a number where they can get back with you with responses to your questions. So thanks everyone for coming.